Knee pain is a common complaint that affects people of all ages. While many cases are mild and resolve with rest, some symptoms can signal a more serious problem that requires urgent medical attention. In this video, we'll guide you through the warning signs that mean you should seek urgent care for your knee pain. Understanding these symptoms can help you act quickly and prevent further complications. Let's start by exploring why knee pain can sometimes be a sign of a more significant health issue. One of the most important symptoms to watch for is sudden, severe knee pain. If your knee pain comes on abruptly and is intense, it could indicate a serious injury such as a ligament tear, fracture, or dislocation. This type of pain is often accompanied by an inability to move the knee or bear weight. If you experience this, it's crucial to seek urgent care immediately, as delaying treatment could worsen the injury or lead to long-term problems. If you find that you cannot put any weight on your affected leg, this is a red flag. The inability to bear weight may suggest a significant structural injury within the knee, such as a fracture or a severe ligament injury. Attempting to walk or stand could cause further damage. In these cases, it's best to avoid putting pressure on the leg and seek urgent medical evaluation as soon as possible. A visible deformity in your knee, such as an unusual angle, swelling, or a bone that appears out of place, is a clear sign that something is seriously wrong. This could be due to a dislocation or a fracture. Such injuries require immediate medical attention to prevent permanent damage and to restore normal function to the knee joint. Severe swelling that develops rapidly after an injury is another symptom that should not be ignored. Swelling may indicate internal bleeding, a torn ligament, or a fracture. If your knee becomes very swollen within a few hours, it's important to seek urgent care to determine the cause and begin appropriate treatment. If your knee becomes red, warm to the touch, and swollen, especially if these symptoms develop quickly, it could be a sign of infection or inflammation. Conditions like septic arthritis or cellulitis can cause these symptoms and require immediate medical treatment to prevent the infection from spreading or causing joint damage. A fever accompanying knee pain is a warning sign that should not be overlooked. Fever may indicate an infection within the joint or surrounding tissues. If you experience chills, sweating, or a high temperature along with knee pain, seek urgent care right away, as untreated infections can lead to serious complications. If you have an open wound or cut near your knee, especially if it's deep or bleeding heavily, you should seek urgent care. Open wounds increase the risk of infection and may also involve damage to underlying structures like tendons or ligaments. Prompt medical attention can help prevent complications and ensure proper healing. Bleeding that does not stop with pressure is a medical emergency. If you injure your knee and the bleeding continues despite applying firm pressure, seek urgent care immediately. Uncontrolled bleeding can lead to significant blood loss and may require stitches or other interventions to stop the bleeding and repair the injury. If you notice numbness, tingling, or a complete loss of sensation in your knee or lower leg, this could indicate nerve damage or compromised blood flow. These symptoms are serious and require urgent evaluation to prevent permanent damage to nerves or tissues. If the skin around your knee or lower leg turns blue, pale, or feels cold, it may be a sign that blood flow is restricted. This can happen after a severe injury or due to a blood clot. Restricted blood flow is a medical emergency, as it can lead to tissue death if not treated promptly. Hearing a popping or snapping sound at the time of injury, especially if followed by immediate pain and swelling, can indicate a torn ligament or tendon. These injuries often require urgent care to assess the extent of the damage and to plan appropriate treatment. If your knee suddenly gives way or feels unstable, especially after an injury, it may indicate a torn ligament or other structural damage. Instability can increase the risk of further injury and should be evaluated by a medical professional as soon as possible. A knee that becomes locked, meaning you cannot fully straighten or bend it, is a concerning symptom. This can be caused by a torn meniscus or loose fragments within the joint. A locked knee can be painful and limit your mobility, so urgent care is recommended to determine the cause and provide relief. If you notice rapid bruising around your knee after an injury, it could indicate internal bleeding or a significant tear in the tissues. Bruising that appears quickly should be evaluated by a healthcare provider to rule out serious injury and to ensure proper management. If you have a personal or family history of blood clots and develop sudden knee pain, swelling, or redness, you should seek urgent care. Blood clots can be life-threatening if they travel to the lungs or other organs. Early detection and treatment are essential to prevent serious complications. If you have recently had knee surgery or a medical procedure and develop new or worsening pain, swelling, redness, or fever, this could indicate an infection or complication. It's important to contact your healthcare provider or seek urgent care to ensure that any issues are addressed promptly. If you experience knee pain after a significant fall or trauma, especially if you cannot walk or move the knee, it's important to seek urgent care. Falls can cause fractures, dislocations, or ligament injuries that require prompt evaluation and treatment to prevent further harm. People with chronic knee conditions, such as arthritis, should be aware of sudden changes in their symptoms. If you experience a sudden flare-up with severe pain, swelling, or inability to move the knee, urgent care may be necessary to manage the condition and prevent joint damage. Pain that worsens with movement or prevents you from bending or straightening your knee can be a sign of a significant injury. If this pain is severe or accompanied by other symptoms like swelling or instability, it's best to get checked by a healthcare professional promptly. If your knee pain is so severe that it wakes you up at night or prevents you from sleeping, this could be a sign of a more serious underlying issue. Persistent nighttime pain should be evaluated, especially if it is new or worsening. While mild discomfort after exercise is common, significant pain and swelling that develop after physical activity may indicate an injury. If you notice these symptoms, especially if they persist or worsen, it's important to seek medical advice to rule out serious problems. If you hear a crunching or grinding sound in your knee when moving it, especially if accompanied by pain or swelling, this could indicate cartilage damage or a meniscus tear. These symptoms should be evaluated by a healthcare provider to determine the best course of action. Pain that is accompanied by both swelling and redness is concerning, especially if it develops quickly. This combination of symptoms can be a sign of infection or inflammation and should be checked by a medical professional as soon as possible. If you experience severe knee pain after sitting or lying down for a long time, it could be a sign of a blood clot or other circulatory issue. This is especially important if the pain is accompanied by swelling or changes in skin color. Seek urgent care if you notice these symptoms. Swelling in the calf along with knee pain can be a sign of a deep vein thrombosis, which is a blood clot in the leg. This is a medical emergency, as the clot can travel to the lungs and cause life-threatening complications. If you notice swelling in your calf, especially if it's painful or red, seek urgent care immediately. If you develop knee pain along with sudden shortness of breath, chest pain, or coughing up blood, this could indicate a blood clot that has traveled to your lungs, known as a pulmonary embolism. This is a life-threatening emergency and requires immediate medical attention. If your knee pain is accompanied by sudden weakness in your leg, making it difficult to move or support your weight, this could be a sign of nerve or muscle injury. Weakness that comes on suddenly should always be evaluated urgently to prevent further damage. Feeling like your knee is unstable or about to give out, especially after an injury, can indicate a torn ligament or other serious structural problem. Instability increases the risk of falls and further injury, so it's important to have your knee evaluated by a professional. If you suddenly lose the ability to move your knee, whether it's bending or straightening, this can be a sign of a significant injury or joint problem. Loss of motion should be checked urgently to determine the cause and begin treatment. A knee that is swollen and feels hot to the touch, especially if the swelling develops quickly, can be a sign of infection or severe inflammation. These symptoms should be taken seriously, and urgent medical evaluation is recommended to prevent complications. If you notice red streaks spreading from your knee up your leg, this could be a sign of a spreading infection, such as cellulitis. This is a medical emergency, as the infection can quickly become life-threatening if not treated promptly. If you have knee pain and swelling, along with difficulty breathing, this could indicate a blood clot that has traveled to your lungs. This is a life-threatening emergency and requires immediate medical attention. If you experience sudden and significant swelling after a minor injury, it could indicate a more serious underlying problem, such as a ligament tear or internal bleeding. Even if the injury seemed minor, rapid swelling should be evaluated urgently. A combination of pain, swelling, and bruising after an injury can indicate a significant tear or internal bleeding. These symptoms should be checked by a healthcare provider to ensure proper diagnosis and treatment. If you cannot feel a pulse in your foot or lower leg after a knee injury, this could indicate a vascular injury. Loss of pulse is a medical emergency, as it means blood is not reaching the tissues. Immediate care is needed to restore circulation and prevent tissue death. If your knee pain and swelling are accompanied by difficulty moving your foot or toes, this could indicate nerve or vascular injury. These symptoms should be evaluated urgently to prevent permanent damage. If you experience knee pain and swelling along with nausea or vomiting, this could be a sign of a severe infection or systemic illness. These symptoms should not be ignored, and urgent medical evaluation is recommended. If knee pain and swelling are accompanied by confusion or changes in mental status, this could indicate a severe infection or systemic problem. These symptoms are serious and require immediate medical attention to prevent life-threatening complications. A rash that develops along with knee pain and swelling can be a sign of an underlying infection or autoimmune condition. If you notice a new rash, especially with other concerning symptoms, seek urgent care for evaluation. Blisters that form on the skin over a swollen, painful knee can be a sign of a severe infection or skin condition. These symptoms should be evaluated urgently to prevent complications and ensure proper treatment. If you experience knee pain and swelling, along with difficulty speaking or understanding speech, this could be a sign of a stroke or other serious neurological problem. These symptoms are a medical emergency and require immediate attention. Vision changes that occur along with knee pain and swelling could indicate a serious systemic illness or infection. If you notice blurred vision, double vision, or sudden loss of vision, seek urgent care immediately. Chest pain that occurs with knee pain and swelling may be a sign of a blood clot or heart problem. This combination of symptoms is a medical emergency and requires immediate evaluation to prevent life-threatening complications. To summarize, knee pain can sometimes be a sign of a serious medical problem. If you experience any of the symptoms we've discussed, such as severe pain, swelling, redness, fever, inability to move the knee, or symptoms affecting other parts of your body, it's important to seek urgent care. Acting quickly can help prevent complications and ensure the best possible outcome. Always trust your instincts and don't hesitate to get medical help if you're concerned about your knee pain.